فأووا إلى الكهف ينشر لكم ربكم من رحمته ويهيئ لكم من أمركم مرفقا.
السلام علیکم. الحمدللہ متین بھائی نے ایک موقع دیا ہے، ایک ٹاپک دیا ہے کہ اس پہ آپ بات کریے، دعا کریے کہ بات اچھی ہو جائے اور فائدہ مند ہو. میں چاہتا ہوں کہ یہ جو ٹاپک ہے چوزنگ دا رائٹ پاتھ ان میڈیسن، کہ اب ایک بار ایم بی بی ایس کمپلیٹ کر لیے، ایم بی بی ایس پڑھ رہے ہیں تو آگے ہم کیا کریں. ایم بی بی ایس کامن کورس ہے، اب یہاں جو میڈیکوز کے جو ہے ہم لوگ جمع کریں، تو میری ایک خواہش ہے جو ایم بی بی ایس پڑھ رہے ہیں یا انٹرنشپ کریں وہ اس طرف آ جائیں تاکہ سلائڈس دیکھ سکے آسانی سے. باقی لوگ ٹھیک ہے، مگر جو خاص طور پہ ایم بی بی ایس اسٹوڈنٹس اور انٹرنس جو ہے وہ سامنے آ جائیں. چوزنگ دا رائٹ پاتھ، کیریئر پاتھ، سلائڈس تو بتا دی. تو اس میں اگر اس کو ہم عربی میں ٹرانسلیٹ کریں تو اہدنا الصراط المستقیم ہو جاتا. فی الطب میڈیسن کے اندر جائیں تو اللہ کے جو ہے ہدایت تو مانگنا ہے ہر جگہ اللہ سے، کہ جو بھی ہم کر رہے ہیں بغیر اللہ کے ہدایت کے ہم صحیح کام کرنے کر سکتے ہیں. اور ایسے لوگوں کا راستہ جن پر اللہ کا انعام ہوا، جن کا پر کرم ہوا، نہ کہ ان لوگوں کا جن پر اللہ ناراض ہے جن سے. تو اب کیا کریں، ایم بی بی ایس تو ہم کر لیے. اب کئی لوگ ایسے رہتے جو خوشی سے ایم بی بی ایس کیے اور کوئی خوشی نہیں تھی، گھر والے ڈھکل دیے، کرا دیے، کر لیے. تو واٹ ٹو ڈو ناؤ؟ دو آپشنس ہیں. اسٹینڈرڈ طرف جو ہے نارملی ایم بی بی ایس کے بعد جو ہے فیلڈس ڈیوائڈ ہوتے، ایک ہے نان میڈیکل فیلڈس ہے. اب میڈیکل ایم بی بی ایس تو آ گیا، پھر بعد میں انٹرسٹ نہیں ہے، ہم کو پیشنٹ کیئر میں اتنا نہیں ہے، لیکن میڈیکل فیلڈ سے کیوں ہم وابستہ ہے، اس کے جو ہے سائڈ برانچز ہیں، جیسے میڈیکل بایو انفارمیٹکس ہے، یا میڈیکل ہیلتھ ایڈمنسٹریشن ہے، یا لیب ریسرچ ہے، میڈیکل لیب ریسرچ. اور ویسے آج کل آرٹیفیشل انٹیلیجنس ہے ان میڈیسن، وہ ہے کمپیوٹر بیسڈ ٹریٹمنٹس، وہ بھی جو ہے نان کلینکل ٹائپ ہے، سب برانچز آف میڈیسن. فرسٹ ایک الگوریدم ہے اس میں، جو فرسٹ ہم کو ڈیسائیڈ کرنا ہوتا ہے کہ ہم لوگ پیشنٹ کیئر کرنا ہے یا ایم بی بی ایس سے ہٹ کے جس میں ایم بی بی ایس کا فائدہ ہوتا ہے نالج کا، ان فیلڈس میں جانا ہے. اور ایک بار اگر ہم سوچ لیں نہیں بھائی ہم خدمت کریں گے لوگوں کے جو ہے میڈیکلی ٹریٹ کریں گے، کہ دو ٹائپ کے کیئرس ہے، دو طریقے سے. یو کین ڈو اے ڈائریکٹ پیشنٹ کیئر، دیر از اے انڈائریکٹ پیشنٹ کیئر. Direct patient care means three branches standard which everyone knows. Medical fields where you treat with medicines. One is surgical field where you operate, and third is combined fields. Some fields we have both, we operate, we treat with medicines. So I listed some of these are not all the specialties, but this is the broad. Everyone, one who enters MBBS, Bachelor of Medicine, Bachelor of Surgery, you are two, and then the mixed batch who will have both medicine and surgery. And indirect patient care like supportive branches, pathology, microbiology, biochemistry. These are the basic sciences which you learn. The first, so these are the supportive branches. Now, how to choose what to do? How to choose what to do? Usually what happens is, what a person is exposed to, he starts liking that most. جو اپن زیادہ دیکھتے ہو اپنے کو زیادہ پسند آتا. اور موسٹلی 90% اسٹوڈنٹس جن کے میڈیسن کا ایکسپوجر زیادہ رہتا، تو سب کی خواہش یہ رہتی کہ وہ جنرل میڈیسن میں جائیں. عام طور سے 80-90% will try general medicine, rest all other branches, because most of the exposure to is general medicine. A person who wants to go for direct patient care usually thinks of general medicine. But unfortunately, or fortunately, whatever it is, there are multiple other options available, and which equally help in giving us a satisfying lifestyle, a happy career, and contributing to the society. So a survey was done for medical students in their third year, fourth year, fifth year, final year. Okay, what are your priorities in life? Once you complete an MBBS, what do you think your next step be? So some 34 various reasons were given that they will think about a practice, a specialty which there is not much of stress, or specialty in which there is surgical field, or whether we have opportunities abroad, whether we have opportunities in the country, what are the opportunities available in our state. There are multiple reasons. Some 34 reasons I have listed here. There can be n number of reasons to decide a specialty. But all this, you'll get more confused. I would like to compress all this in a few things so that you will be able to plan your future better. Plan the correct path which will be satisfied. You have to ask yourself first, number one, do I want to get involved directly in patient care, treating patients, or indirect care? First step you have to decide in the decision-making pathway. And secondly, okay, I have decided to do direct patient care. So you have now two options, whether you have to go for procedural fields, non-procedural fields, medicine or surgery, two branches. Medicine, you may not need much of skill, but surgery is skill-based. If you want to get a hernia operated, you go to the skilled best hernia surgeon. You might have a lot of knowledge, but if you can't operate, that surgery is going to fail. So surgery, patient, but person, the doctor who is going to operate should have knowledge and also skill. Nowadays, even in medicine, there are a lot of skill-based procedures. Interventional cardiologists are there, intervention gastroenterologists are there. So even in medical fields, there are some interventional branches. But surgical branches are totally skill-based. So this is aptitude, how our aptitude is, whether we have thinking mind or we have thinking and skilled hands. And lot of patients will be needed in all branches. Third, each field has its own difficulties. You see in your college how a physician lifestyle is. You see in your college how a surgeon's life. You know the differences. Emergencies will be there in some branches. In some branches, there will be no emergency. So you have to decide whether you have to go for emergency branches, non-emergency branches, academic branches, where you have a big team. You want to work in a single doctor clinic setup. So this is how your lifestyle you have to think. And this last outpatient, inpatient care, whether you want to be in a hospital or the other run a clinic, like dermatologists are there, they won't need a hospital, they can run any clinic. Even neurology practice can be done in an outpatient neurology, you can do. Actually, if you look all branches of medicine, you can treat in the clinic. You may not operate, but you can give advice. But fulfilling a specialty in outpatient, there are some which you can do. Radiologists need not even go to a clinic. Now we have online telemedicine. They can sit at home and then give the reports all over the world. People are doing it. We have a tie-up with an 5C network in Bangalore. All our images go there. Within 1 hour, we got a report. They have 150 radiologists sitting there. They are at home and they're working from home. So you can have this lifestyle also. So these are some basic questions which you have to ask yourself before you think your career path. But some help is there. In your MBBS career, when you are studying biochemistry, anatomy, physiology, some subjects you might have a good grip on. You feel you are very confident in those subjects, you might have scored well, you like them. So they can help you in some decision making, like this. You can't become a surgeon without good anatomy. You can't become. You have to be a good anatomist to be a good surgeon and a good radiologist. You can't become a good internal medicine person without a pharmacology grip. You should have thorough grip on the medicines, then only you can prescribe well. So various branches give various tilts to us. So once we complete in our internship, we can think which subjects on which we are having lot of grip. And once we have grip on the subjects, we can take those type of specialties. You decide. And the factors to consider. Once we have decided, so I like physiology, I like biochemistry, I like these subjects, these specialties may be better for them. Then again, you have some more other factors to discuss. Suppose I decide now, okay, I will take radiology. Now, radiology, I am interested, I have the knowledge, I have anatomy knowledge, I have a good other knowledge. and it's an easy job. I can sit at home, do telemedicine. But the other factors you think is how our lifestyle changes with those specialties. How our lifestyle changes with the specialties which you have chosen. Various specialties have different lifestyles. So you have to see those people before going to the specialties and see whether that lifestyle suits you or not. A person is doing emergency medicine. Lot of stress will be there. Daily they get critical patients. They have to treat high adrenaline job. Or a person is doing pathology. It's a low adrenaline job. You work at a place, coolly, calmly, study the slides, take 1 day, 2 days. If you have doubt, you discuss. After 10 days also you can give a report. But in emergency, can we spend 10 days, hours? It's a matter of minutes and seconds. It will make a life difference. So you consider which type of jobs, depending on the lifestyle of those branches, the duration of training, and the earning potential. Earning potential of the branch is also one of the factors in decision. If we have a lot of financial implications, obligations, maybe we have to go for the practices which give us more financial benefits. I have condensed all the factors into eight things which you can. First is your personal. First, assess your strength. Assess your interest, what you like. Second, identify your strength. See, unless we know ourselves, we will not be able to take the correct specialty. You first assess yourself. Assess what is your interest, what is your strength, what strengths. I ask the basic sciences. Some people have grips in some subjects, so that will help you. So you assess your interest, first self-assessment, assess your strength, and then consider what work-life balance you want to have. And one more thing I would suggest is you think about the future demand in that subject. Suppose you take a subject, in future there is no demand for it. What is the point in doing that? You will not doing any contribution to society. So you think which field is going to progress more in future, the need will be more in that, and you try to do it. Earlier geriatrics was not considered a field. Now there is a huge demand for geriatrics. Earlier pain was not considered a field. Now there is a huge demand for pain medicine specialists. Lot of people facing pain clinics everywhere. So professional wise specialties change. Some demands, sometimes earlier surgery was in demand, later medicine was in demand, later radiology was in demand, now dermatology is in demand, maybe in future psychiatry will be in demand. What society needs, you have to fulfill. So you take that branch which is you think in the next 20 or 30 years is going to have a potential demand. Second, about the specialty assess. One is your personal assessment you have done. Now you assess the specialty. How much training you have to do. ENT 3 years. General surgery 3 years. You want to go for higher specialization. You want to do radiology 3 years. But you want to go for intervention, another 3 years. Cardiology, medicine 3 years, cardiology 3 years, 6 years. And if you want to do further facility, another 2 years of fellowship, 8-9 years of training. So you think whether you are be able to go for that length of training. Suppose you don't have that capacity, don't go for that long training branches. And always take mentorship, mashwara. Always take mentorship. Take help from people who are there in the field before finalizing it. Not the initial. Don't ask your seniors. They will not guide you. They don't know themselves what field is going. Don't ask seniors. Ask the persons who are senior most in the field. Go them, meet them, stay with them, and then finalize that specialty. I'll try to do this. You take their guidance. They will tell you well. And financial considerations. Each specialty has different financial. And lastly, each field has a research aspect. Some fields there are lot of innovations going on, like neurosurgery. When I started neurosurgery, I expected lot of innovation, and there are a lot of innovation going on and on. It's continuous process. In all branches there are innovations, but in some branches there are extreme innovations. You will have a lot of scope. You try to find out which innovative field you want to chase. I know I have bored you with a lot of things, but I'll further condense it to you. Only 3. You think about only 3. First, what are your interests? Second, what is your skill? And third, what is your lifestyle preferences? Whenever you decide a branch, you take these things in combination and then go for the decision, and always take mentorship from the seniors in the particular field. I have told about interest, skills. People have evaluated personality of a person. They have tried to match a speciality with a personality. This is an old inventory which is still being used for helping students. There is a careers in medicine website, USA. American Association of Medical Colleges have a careers in medicine website. They assess the patient, the doctors, they help the medicos depending on their personalities. Four personalities they have taken: extroverted, introverted, sensing, intuition, thinking, feeling, judging. There are 16 combinations of this. And this helps in evaluation. You can go there online, you can do the testing and assess yourself which person. This is not hard and fast rule. This is not hard and fast rule. This is a general personality type testing. You can get yourself tested and see what is best for you. It may be correct or not, but there is one guideline. Okay, in that result, we have taken a specialty. Why we do a specialty? Finally, we think of doing a job. The net result is you want to do a job. So what should be your aim for the dream job? These are people have researched on this dream job choices. They have come to 6 points. Any work in which you are happy to do, that job you should be happy. You should be able to go there daily and work, or stay at home at work. You should be able to do the job. And it's a job that should be helping others. And it is a job you should be good at. See, you have to be best in what you do. There is no other option. You have to be the best in what you do. You do less, but you do best in that. You need not do everything, but do some, but be best in that. You try to turn. And always work in a supportive atmosphere. No point in working in a place. You try to see where people will support you, you do there. And a job that fits your personal life. So you should be good at that job. See, there is a hadith of Nabi Pak Sallallahu Alaihi Wasallam, and he has advised that person, in whatever you do, it is immaterial. Even if you be a cobbler, you do a good job at it. Be good at it. Whatever job you do, you try to be good at it. Try to help others. A work in which you try to help others will give you a lot of satisfaction. And that job should not be a burden on our personal life. Job should not be a burden. Two doctors, wife, husband, both are working in critical care departments. Emergency schedules, surgeries and all. How is their family going to work? You tell me. It's not going to work. The family is going to suffer. So you try to do a job, you plan in the future. See what decision you make at the end of MBBS, it will going to affect you for the next rest of your life. Till the end you will be thinking why you have made that decision. So you decide your family also at this point of time. Lifestyle preference means how much life you want to earn, how you want to stay with your family, what time. So I will end my talk with some important points. 2 overrated goals in a career. Earning money. People think earning money makes us happy. And one advice is do what you like. Do what you like. See, it's not like that. It's not so easy. This is a chart. The lower graph shows the income. Once the income starts increasing up to a level, it will fulfill our needs, give some satisfaction. But after that, you earn more also, it won't help you. Another study on the same subset of people have done. The income is same, but the people who are happy with their lives, they're happy even at a lesser amount. Your needs might be filled at a higher amount, but you can be happy even at a lesser amount. So money is not the criteria. This is the last chart. You see the last line, stress-free. If you earn, when the energy it was 15 years data, but 15 years old data, but it still stands true. At a particular level, that stress-free level, if you see, once you start earning more, your stress again increases. I mean, once you go at the other end, you again go back to high stress levels. So money is not going to bring you peace, bring you satisfaction. It's not good. At certain level, it will sometimes fulfill your needs, but after that, you are going to be stressed out. So let that not be the most important criteria in your life. Second is do what you like, follow your passion. No. This business of follow your passion, it was never mentioned till 1995 in the books. It has become a marketing gimmick from the last 15-20 years. Do what? It's not like that. We are responsible people. We do what is needed, not what we like. See, we do what is needed, what we feel is the best for. We do work which will make a difference in people's lives. Ultimately, see, our life is one which should bring a difference in the society. Difference is people's life. In our life, in society life. How we can do it? By helping more people. You think about helping, even you may be a biochemist, you may be a pathologist, radiologist, surgeon, medicine, whatever field, you think how you are going to make a difference, and we can make a difference by helping more people, doing more that benefits for a longer time and for the future generations also. Don't consider your life, I want to improve my life. Let your goal not be very small, let it be wide. We will think about the entire. See, we are Khairul Ummat. For the entire nation, for the people's generations to come. Think in that terms, not in a short terms. ORS therapy. We know this helps saves life. Till 1950, 1960, people used to die because of diarrhea and vomiting, cholera, dysentery, deaths. Millions of people have died. One doctor in 1916 Bangladesh, he researched, he thought, Dr. David Nellin, and he realized we can give water with salt and sugar and it's saving millions of lives. A doctor might save 100,000, 2,000 lives, but Dr. Nellin, with a simple therapy, he found out he was able to save millions. Dr. Landsteiner, he is a person who has found out the blood groups. It has saved even more. So if you think in perspective, how much help we are going to do, see the perspective. A single doctor will do this much. If he goes in other varying areas, he can do more. So do what contributes, not do what you gain. See, it's not going to, it will end. It will end. Okay? Do what you can do. Be good in what you do and do what it contributes. And prioritize that. There's a book called Give and Take. If we make it a mission, if you make it a mission to help others, people will help you. If you make it a mission to extract from people, I'll try to extract, you'll fall. So you try to think, I want to help people and do work in that way. People will help you succeed. ठीक है? देने वाले को अल्लाह देते है ना भाई, तुम दो मैं और देता हूँ, बोल रहे हैं दो मैं और देता हूँ, बांटने के लिए है अपन आप. वी आर ओनली डिस्ट्रीब्यूटर्स. देना लेना बस देते रहे तो ऊपर वाले से लेते रहते. So people with a mindset of being more successful, they get more help. And they are driven by purpose also. Life में purpose रहता. Otherwise, at the end of the day, you will feel what I have achieved. I have made a house, I have made a building, I have made a car, I have enjoyed life. What have I achieved? Zero. Secondly, see, we want to help others, but not at the cost of ourselves. Not at the, no need to burn ourselves out. Okay? You do in a limited manner. In Quran Sharif, there is a surah in which there is a ayat which says you give to people in charity. Immediately the next ayat says, don't give so much that you are becoming dependent. Don't do extra. So set limits in your career. When you decide about your work lifestyle balance, you decide how much time I am going to give my family, how much time to give to my work, or how much to the society. See, this is a basic chart. There is an ability graph, there is a demand graph. If your ability increases, the demands also will increase and your challenges also increase. You have no ability, then you will become anxious. You will not be able to fulfill your job. If there is no demand, even if you have ability, you will become poor. So that's why you have to think specialty for the future. Not now. You think 10 times, 30 years down the line, how this specialty is going to contribute to the world, and then decide accordingly what is the requirement. So you take the help of your mentors. So demands and ability. So we can't develop the demand, but at least we can develop an ability. So you do your internship very well, do internship very well, do your MBBS very well, do your training well, go to the best centers. Don't go substandard. Go to the best center, national, international, wherever they are going to give you the best, go there, learn, and then do. You can do there, here, anywhere, but wherever you have to train yourself well. That is my message. Don't shrink from hard work. Don't shrink from stress. See, to have a great career, don't worry your money and stress. It will be there. Okay? But always try to do something which helps others. It is best for you, best for everybody. I will end here. So, try to be helpful. Try to be helpful. You will be successful. And to be helpful, develop ability. Develop ability. You should become the best. That's my core message. Try to become the best in the field. Inshallah, with the purpose of helping others. Not best in the field to get money. It is not going to help you. You are not going to get sad. Okay? So try to be helpful. Become the best to become helpful. And try to contribute more. Thanks for your patience. Jazakallah.